Christmas holiday is not slowing down our healthcare workers on the front lines of the coronavirus pandemic, though the distribution of the COVID-19 vaccine is giving many hope for an end to this pandemic in next year. Oregon's Deputy State Health Officer and Deputy State Epidemiologist Dr. Thomas Jean joins us this morning with a look ahead and an update on the latest in the fight against the virus. Doctor, good morning.
Good morning. Happy to be here.
Yeah, thanks for joining us on this Christmas morning. First, let's get right into just the latest on the vaccine distribution. What updates do you have from this week here and the rollout across Oregon?
Yeah, we continue to roll out doses of vaccine. We had about 35,000 doses in Oregon last week. And we're expecting by the end of the year, by the end of this month, about 100,000 doses of each of the two vaccines to be administered. And those are mostly going to healthcare providers as well as residents of long-term care facilities like nursing homes.
Yeah, I know we're currently still in that first phase 1A of this vaccine rollout. Any updates, any indicators as to when we could be moving into the next steps?
Don't know any exact dates, but early in the new year.
Okay,
The next phase, and that phase will include essential workers, everybody from potentially grocery store workers, bus drivers, police and fire, etc.
Yeah, something to look forward to here in the coming weeks, certainly. We had some concerning headlines this week about this new COVID variant, this mutation being reported in the United Kingdom. We're starting to see different travel restrictions and advisories. That country really trying to shut down here ahead of the Christmas holiday. Do we have any indication that that variant is here in the United States, or have we seen any evidence of it in Oregon?
No, we have not seen it in the US, although it's certainly possible that it's here. So it's something we're watching very closely. We're not sure at this point, world experts are not sure whether those mutations and changes that are seen in the new variant are directly behind why it may have spread so fast in the UK. It certainly could be just the fact that it was mutations happen all the time. So it could be just that those changes were in a virus that spread very rapidly for other reasons. For example, somebody who wasn't wearing a mask in a large group of people. So it's something we're going to continue to watch closely.
Yeah, I think one of the other challenges here is just because this virus is relatively still so new, we don't necessarily know how quickly it could continue to mutate going forward. I mean, do we have any idea of just how often we might be seeing these new mutations of the virus?
Well, all viruses are mutating all the time, and generally it's not a reason to be concerned. In fact, the coronavirus does not mutate as fast as many other viruses, for example, influenza. But it is something, especially with a global pandemic, there are, many copies of the virus in millions or if not billions of people around the world. And so there are opportunities for mutations to happen. And in some cases, those mutations could increase transmissibility. So it's something we need to be careful and we need to look at all the data. I don't think there's any reason for concern at this point. And there's no reason to think that the vaccines will not be effective. But again, we need more data to make sure that that is not the case.
As we look ahead to January here, coming off of the Christmas and New Year's holidays, despite the advice of health officials, we are still seeing many Americans traveling for the holiday to be with family and friends. Are you concerned that we're going to see another spike, another rise in cases?
We are certainly concerned about that. We know that people want to see family and friends for the holidays. We really are urging people to minimize any travel, stay home, do video get-togethers and phone calls to the extent possible. Just because, even though we want to see our loved ones, we also don't want to spread COVID to them. We don't want them to get sick. We don't want to see another spike in infections around the country as we have seen after some other holidays.
Yeah, and do we have the adequate availability of testing right now in the state to handle what could potentially be an increase in people wanting tests if we do see a surge after all of this?
Yeah, we have continued to expand our capacity in Oregon steadily. So at this point, we're seeing pretty good turnaround times, and we've distributed rapid tests throughout the state, making sure that all people will have some access to testing.
And I know there are some more over-the-counter tests, being made available or hopefully very soon, going to be available for people. Do you feel that those are accurate? Are you confident that people are going to be able to test themselves and quarantine when necessary?
Well, there are now hundreds of COVID tests that are out there on the market. Not all of them have received emergency use authorization from the FDA, which is what we would recommend for any test that anybody uses. But there are now a handful of tests with that authorization that are actually now in-home tests, and there are many, many that are rapid tests. So I would urge people to talk to a healthcare provider about testing, and that's the safest way to make sure you get a reliable test.
Sure. Well, we are certainly thankful to talk with you on this Christmas morning, and hopefully we're going to see trends headed in a more positive direction here in the new year. Dr. Thomas Jean with the Oregon Health Authority, thank you so much for joining us this morning.